I'm impressed. I think it works. Yeah, I was wondering about my presentation. Sometimes you do them on Mac and then it works, and then on my computer at work it was horrible, but it looks really good. And I don't like to be on a podium, so I'm just going to come down. Thank you for the microphone. Yeah, when I got this invitation, it's the first time that I was asked to actually talk about yoga to anybody, to whatever, fellows and colleagues or patients. Sometimes we do yoga at the foundation with some folks. We actually had pre-COVID also like a session for cath lab staffs on Thursdays or so. We did that early in the morning so that everybody could still go to work. But actually talking about it in the context of cardiovascular disease is a first. So, you know, that was exciting. But then, of course, you know, if I look at Dr. Palmer's slides, I'm more like, oh my God, look at what she does, right? It's amazing. But yeah, I think it's a very important topic actually because it comes up all the time, at least in my practice, as people might look me up before they see me and then ask a couple questions about it. So I called it more cardiovascular disease because I think you can't specifically talk about aortic valve disease necessarily in this context, but so we go from there. Let's see. So I think for yoga overall, it's important to just consider a little bit the history of it. And as you can see here, because there's so much confusion often, and I think if you go through a yoga teaching class or, you know, once you become a yoga teacher, you go for, you know, several weekends and months through that training. But if you think about it, yoga really started maybe around the 4th century, and that's what they say as the Yoga Sutra of Patanjali maybe was the first explicit scripture about yoga. And then if you think about it, now that you go to maybe some yoga classes, I wanted to ask that actually, who does yoga? 4, 5 maybe? Yeah. So, I mean, not many people. And who thinks that they would never be able to do yoga? Be honest, right? So 3 or 4 people think that, right? Who would try it but is scared? Just because of whatever. Yeah, right? Can someone who's scared say why they would not try it right now or haven't tried it yet?
I have a lot of body pain. I have arthritis and
Yeah.
vascular disease, diabetes.
Yeah.
I
Yeah.
just kind of live in a little bubble, I guess.
Seems to be like, oh, yeah, protective bubble, and maybe some people think like, oh, I mean, I see these like super sporty people in the yoga class, you know, I cannot follow them or so, you know. That's exactly the problem, right? Because everybody thinks this is a sport. But if you think about it, around the asana, so basically all these like yoga poses that you can think of, right? Until the 11th century, the only thing that people actually did is meditation in a seated position. That was yoga. So in essence, if you think about it, much of yoga actually is meditation and mindfulness, right? So that brings you, and I will say that many times, whatever you want to do in yoga is yoga, right? So if you want to learn it and then just pick a couple of things from it, that's your yoga. It's not that you have to follow some sort of flow in some sort of exercise room. Hatha yoga, for example, that's what I usually practice, is a strengthening yoga. And that was actually, and this is recently being talked about in many articles, and this is an interview with someone who really studied that a lot, and it's mentioned down below if you're interested in this person. It probably even comes from a Buddhist tradition, how the strengthening yoga was developed. So it's many influences there. And then prana, this life energy, like taking breaths and such, that's probably where one of the texts, that's Hatha Yoga Pradipika, probably describes that the most. And then you think about the asanas, that's so the body positions, you think about pranayama, the breathing, the methods of yoga, the concentration on the inner sounds, and meditation. Those are all practices within yoga, right? And then we continue. So I told you about just meditation as a seated position. So people were seated and meditating, inner, sounds, listening. Those were the first parts, and then 15 positions were actually really described in this first scripture there. 15 out of like what you now know, probably 45, 50, 60 that you could do. And how the first teachers actually thought about it is anything that you see in life could be a position or a practice, right? So anything you see a toddler, what they do, I would say that everybody who knows a toddler has probably seen 10 yoga positions that they do automatically. They don't know anything about yoga, right? But they do actually do some yoga positions, right? We just call them that way now, but they actually do it. And then you can, go on and on and on. At the end, what I thought was, what I picked up for myself the most is really this one here. Pick whatever is best for your meditation, right? So don't get confused or distracted by something you see or one teacher that is very particular. That's not really the point of yoga. Yoga is really mindfulness, meditation, and maybe picking some sort of an exercise if you want to out of it that really speaks to you and not dictated to you by someone else, right? So that's the most important part. If you only remember this for today, perfect. And some gurus actually thought that the strengthening exercise of yoga is really like a hardcore yoga. And if you think about it, and we can talk about a couple poses that I usually do, if you really do them thoroughly, they are really, really highly strengthening exercises that everybody wants to do probably in other exercises too. More and more was described 16th, 19th century. Then overall people think that it's still under development, it's not really finished, right? So people contributed on and on. And then what people might know and do in some of the yoga classes is the sun salutations, right? So there's like, I don't know, 10 different poses. There's A, B, C's, variations to it. But these sun salutations that some people do in repetition, right? Sometimes there's these competitions of 50, 60, 70 in a row. Actually just is probably 100 years old, right? So something that we do and think, oh, this is probably, a long history of it. It's not too old. So then, overall, what's also important, I think, for yoga, because it is about meditation and mindfulness, and in a lot of it, it's really not an exercise program, if you think about it, is how you interpret your own yoga, right? Is it a monistic or a dualistic interpretation? And fancy word, but what they both mean is, one, you can see it as a unity between you and the cosmic spirit, right? So you can, you don't have to be so fancy about it, but what it really means is, if you meditate, if you find mindfulness and you do this practice on and on and on, at some point you can unite yourself with the upper spirits, whatever you believe into, right? There's no judgment there. Or you can see it dualistically and you say, I'm gonna just separate myself from the unimportant stuff in the world, right? The matter. So then I think either way, I find it a good way to interpret yoga, whether or not you find that unification, or if you really take your time and forget about these things that influence you in a negative way. Either way, I think it's very good. Now, I was asked to find evidence about, yoga and cardiovascular disease, maybe even valvular heart disease, and it's not easy because yoga and like really hard evidence is probably hard to come by. And if you think about this paper here, for example, it describes that yes, there is definitely a promise for lifestyle interventions, and any kind of lifestyle change is always helpful. And there, I will show a couple more slides about evidence on certain diseases. But overall, there's probably not enough, let's say, finance support to really do a well-controlled trial and analyze, the differences of yoga or no yoga, and then also to find enough people who would do that, right? So what you will see throughout these next few more slides is that so many things are true about lifestyle changes and mindfulness, and that's true for yoga as well. And if yoga is something that helps you to find that mindfulness and lifestyle change, perfect, right? So then that's your way of changing and increasing that part of your your life. There's a lot, and I think the strongest evidence is really this slide about yoga and cardiac rehab, so after PED surgery, right? So before we can talk about that too, but in that particular instance, in the cardiac rehab, there's actually very good research that if you could incorporate yoga into cardiac rehab, you would probably see self-rated health and return to, for example, here, before heart attack activities, right? And if you think about even most recent fancy trials, the only outcome that some of these trials had is improved self-rated health, right? I mean, even the fanciest trial have that, so yoga has led to the same. But it doesn't really show, and that's what is called MACE in our world, is basically these major adverse events, right? So it doesn't really have that statistical power to say, okay, someone is not going to have more heart attacks or more strokes if you do yoga. That's hard to do, I think. But how you feel and how you judge your own life and how it's going to be for you, yoga can definitely do something there for you. Blood pressure. For blood pressure also, if you think about it, blood pressure is probably a genetic disease, but if you can relax a little bit more, for example, if someone is under Dr. Palmer's surgery, right, they can have a blood pressure of 190 when they see her. As soon as they sleep, 120. Right? So the anxiety leads definitely to much more compression of vessels, arteries, and higher blood pressure. So if you think about what you do with yoga, once you practice that a lot, you can for certain reduce that resistance of your vessels. You can relax and you reduce blood pressure. So that has actually shown to be quite useful to reduce blood pressure somewhat. It probably doesn't get you away from medications, but it can support it. What is important there, and I just put it there just in case someone picked that up, is don't do positions where your head is lower than the rest of your body, because that's going to increase your blood pressure, right? So don't do that, and every good yoga teacher would always probably ask you, for example, so what's hurting today, right? And not just go with whatever they want to do today. They should really ask how you feel and then adjust the program to that, right? Anxiety. So I think before you see Dr. Palmer, right, she is definitely anxiety provoking, right? If you see her, you might want to start yoga. That also has shown good evidence, right? That you can, and again, think about it, right? It's about meditation, self-awareness, mindfulness. That can really lead to improvement. Pranayama is this art of breathing. If you think about all these fancy apps that you now download, right, and they speak to you in the morning and they say, oh, let's do a meditation. Most of what you hear of these teachers telling you is really the old pranayama teaching, the breathing techniques of yoga, right? So no matter what it would be, let's say they say, take a deep breath in and out. Think about what happens to your breathing, right? Think about how your body moves, how your belly is moving. All of that is yoga, right? It's just reframed for you in a fancy app, right? But that's what that pranayama is about, and obviously we could talk about each of these for 20 minutes and longer, right? So I'm just mentioning a few of those. Fancy word, endothelial function. So if you think about our heart vessels, even the big ones that you just heard about, especially the small ones, they all have an inner lining, right? When you smoke and you have too much cholesterol, this inner lining produces this disease here, the plaque, right? But before it gets to the point of like a plaque or a blockage, what we think is, at least, is the tension in that system and how it reacts to certain stressors. That's endothelial dysfunction. So it should react in a certain way. If it doesn't do the right thing, that's a dysfunction. There, again, also some logic behind it. Yoga has shown in some people that have tested that in a lab or with people that it could have an improvement. So that would be a good information, because in conjunction with, let's say, watching your blood pressure, watching your cholesterol levels, this could certainly be also an interesting investigation. Heart failure also, like rehab, in heart failure, there's also stronger evidence. So heart failure means anything with the heart and shortness of breath, right, doesn't mean that your heart function is super, super low. Anytime someone says you are short of breath, and most likely your heart has to do with it, that's heart failure, right? And there, especially the breathing techniques help patients. And honestly, when you see sometimes people really, really nervous on the floor under a new therapy, and you actually spend some time with them and teach just a couple breathing techniques, some have an immediate effect, right? So it's say, oh my God, now that I like really watch my breathing much, much closer. So I see, even if it's not the strongest, let's say academic evidence, but I think from person to person, yoga can certainly help you there as well. I found this really, as I said before, there's certain sentences that for me, at least, are the most important ones. And this one, as long as you do yoga, you will have success no matter what that means to you, right? It is always fascinating to me to see that most of the people wouldn't do it, right? Some people do, and some are actually afraid of it. And I think sometimes it's this class circumstance where you see people who are super focused and know every workout that there is in yoga, and somehow the community doesn't get bigger. It's always the same kind of community, right? What I would suggest then, if you're interested find a yoga teacher that teaches you a few sessions on your own, right? So just go to a 1-to-1, 2-to-1, or something like that. Invest that money, because then you find that it's actually what you want or not. And then you can take it. In these big classes, sometimes the flow is already so incorporated in it that it may not be speaking to you because it's just so new to you. But at the end of the day, don't feel judged by someone who thinks you need to do it in a certain way. There's just no certain way, right? So you pick out of all of these sessions, out of all of these practices, whatever you think is good for you. And I think the most important part of yoga is actually to find some mindfulness and meditation techniques and breathing techniques, so not just the sporty aspect of it. And I can imagine some people, hopefully, wonder what I do. So I don't do 50, 60 practices a day. I don't have time for that. I don't have time for that every day. I think I try to practice the mindfulness daily in a way that everybody can learn. But when I go on the floor or so and I have some time between cases, then I usually, I feel bad about my body, then I definitely go do it. Sometimes I try to do it preventively. So my favorite ones are, for example, the cats and cows. Who thought that this was a yoga pose? It is a yoga pose, right? So you see some of that where you say, oh my God, this is a yoga pose? Yeah. So many of these are things that you may have done in physical therapy, right, are yoga poses, right? So this is a yoga pose, cats and cows, super good for your body, for your back. So when you start doing yoga, you have to warm up first. This is a nice warm-up. So that's always my favorite warm-up. Then actually this has a name too. I always forget about it, so I did forget about it again. But you can advance the first one, the cats and cows, by just like alternating your arms and legs and stretch them forward. Many physical practices do that too. I do that too, and then sometimes I look back, at my feet, for example, just to stretch my back even more. So easy to do. Then, of course, the child's pose. Almost everybody knows that. Again, you have to always think about, can I do it with my body? But if you can do it, this pose, this is super relaxing. And this is also, by the way, the pose that you should do if you go to a yoga class and you say, holy, what are they doing right now? I cannot do that. That is the pose that you indicate to the teacher, I'm just going to take a break here. This is, I'm going to do that. So that's official. Yeah, that's not a joke. I know everybody laughed, but that's actually true. Yeah. You do that pose, and people know, okay, too hard, doesn't want to do it. Yeah, that's the substitute. Then the downward-facing dog, right? This one. And then the opposite is the upward-facing dog. Those are really good for your back. Yeah, it's not about, for example, the downward-facing dog. Everybody thinks that getting the feet on the ground is the goal. Yeah, maybe at some point, but actually the goal is the back, right? So it's a very important pose for the back. And then I do often twists. So once I warm up, not in the beginning, but once I warm up, I do these twists on the floor. This is one of those twists where we can talk about it if you're interested at some point, but you can twist your lower back there a little bit. Then I do figure of 4. Now, this is very good for men and women, but I think in particular women, because sometimes there's a little bit more resistance in the joints of the hip. So the figure of 4 or the pigeon pose are very good for reducing that stress. So that's a super easy pose that I do. And then another twist like this, where you can, more the thoracic spine, where you can twist that for a bite. I mean, you have to learn that, obviously, just not looking at the picture, but this is one of them. And then I always finish up with the Shavasana, right? So these corpse poses. Many people I've heard also do yoga and then rush out of the, out of the lab and do the next thing. These, 2, 3, 4, 5 minutes of that last pose are actually super important for yoga, right? Just to reflect again on your body, take a deep breath, listen in, not be distracted from any other sounds. And that is one of the big practices, right? Can you do that without all the noises in your house, for example? Can you just, take a moment and just focus on yourself? Even just that practice, right? If you just think about laying on the floor and every day trying 3 or 4 minutes to concentrate just on your body and trying to not hear what's going on the street and in your house, that would be a good start to actually try a yoga practice. And then what I'm also a big fan of is, and many people do not know this at all, it's called restorative yoga, right? So for you, for example, pointing at you, restorative yoga would be really, really good, right? Maybe not this particular pose, right? I'm not saying that, but there's like 7, 8 poses where your body is completely supported by a cushion, right? And you're doing this for like 10 minutes, 5 minutes, yeah? And if you look around, there's probably a yoga studio that offers that. It's called restorative yoga. So your body is completely supported depending on whatever aches and pains you have. They have props like this, 30, 50, 60, whatever. And sometimes you lay there and there's 20 props around you so that every joint is supported and you're completely relaxed and you're just going into that certain pose. So if someone wants to try yoga but is not interested in this super activity yoga, look for someone who might offer the restorative yoga. That is super good for like back pains, all kinds of pains, right? So I hope that was a little bit about yoga and cardiovascular disease. And here's my email. So if someone is interested, doesn't quite know how to start, I can send what I do sometimes in classes and what kind of poses I suggest. I can also refer you to yoga teachers I know that I think do a good job. But yeah, if you have any other questions, just email me. And hopefully 2 or 3 more people will start yoga because of the talk. That will be the big success. That's it. Thank you.